The number of coronavirus infections reported today in Korea came down slightly, below 170,000, but the peak is still expected to be more than twice that, likely in just a few weeks. With so many people infected, the authorities have dramatically loosened the rules on self-isolation for those living with someone who's tested positive. Shin Ye-eun has this report.
South Korea on Friday reported 165,890 new COVID-19 infections. Despite the drop in cases, the number of critically ill rose by 74 to 655. The Prime Minister on Friday said Omicron will most likely peak by mid-March, when daily infections could surpass 250,000. He added how authorities will address the situation.
The government will supplement the country's medical system so that it can contain the spread of Omicron effectively. In order for us to do that, we will first take some of the burden off the overloaded workers at medical clinics.
The Prime Minister said some 3,000 public workers will be dispatched to different regions along with 1,000 military personnel to support the medical system. Authorities are also set to change the quarantine rules for unvaccinated people who live with a COVID-19 patient. As of now, unvaccinated cohabitants are required to self-isolate for 7 days. But from March, they won't have to quarantine and instead will be monitored for 10 days. They're also asked to get a single PCR test in the first 3 days. Then on the 7th day of their monitoring, they will be advised to test themselves with a home screening kit. But neither of these tests are mandatory. Authorities are also thinking of designating an emergency room just for young children amid the growing number of new infections found among those aged 18 and below. The number of infections found in this age group has more than doubled compared to last week. As of Wednesday, they took up more than 26% of new infections. Authorities said they would increase the number of hospital beds just for young children and teens to some 860. There's also some 95 centers nationwide that provide medical counseling and diagnosis for children and teens recovering from COVID-19 at home. Authorities are also considering tests that don't use the invasive and sometimes painful nasal swabs and instead use a saliva-based PCR test that only requires people to spit into a tube. Once the Ministry of Food and Drug Safety gives the green light, this test will be used at screening centers and at schools. Shin Ye-eun, Arirang News.